My presentation on vascular Ehlers-Danlos syndrome for a program that I applied for called Master Teacher. And in this presentation, I discuss why I chose to discuss vascular Ehlers-Danlos syndrome. I talk about some signs and symptoms, how to diagnose the disease, and then finally, I talk about the exciting new treatment possibilities for patients that is very recent. So why this is of interest to me, my daughter Andy had vascular Ehlers-Danlos syndrome, also known as VEDS. The geneticist that diagnosed her knew very little information about the disease and gave us a lot of misinformation, and this really led us to not really understand the severity of the disease. It led me to question everything I was reading online, whether it was exaggerated or not, and we just didn't really have a good understanding of the disease. In addition, we were really confusing it with just other types of Ehlers-Danlos syndrome. We were part of Facebook groups and stuff like that had to just do with Ehlers-Danlos syndrome, and we didn't really understand that we needed to connect with VEDS patients specifically. Andy passed away at age 20 in 2019 from an iliac artery rupture. She was really mistreated at the hospital, and really it shouldn't have been something that took her life. I started Adventures in Love for Andy, a nonprofit organization, in her memory. Me and Andy's stepmom, we work really hard to raise awareness for VEDS along with our family and friends. We fundraise for VEDS patient treatment, and we fund and give out VEDS scholarships for higher education. So some symptoms and diagnostic features of VEDS include most patients have really easy bruising. They have very thin skin that's prone to tearing. They have very characteristic facial features such as thin nose, thin lips, and large eyes. 25% of major complications occur by age 20, and median life expectancy is 51 years old. Most of those major complications that occur are spontaneous ruptures, and they can occur in hollow organs. To get a positive diagnosis, really you need a genetic test to determine if you have a pathogenic variant that exists in the COL3A1 gene. There is another gene that can lead to VEDS, but really the most common is the COL3A1. That codes for type 3 collagen. And patients with VEDS have faulty collagen, and they're usually heterozygous for that, where they have one faulty copy and they have one regular copy. Sometimes patients have a variant of unknown significance, and this really just leads to more questions. They need to be observed to see if they have VEDS characteristics or not. Still is so much left to know about the disease. Another way that VEDS can be diagnosed is a biochemical analysis of fibroblasts to look for abnormal type 3 procollagen. And the COL3A1 gene, this diagram is just showing that it's found on chromosome 2. So current treatment and management of VEDS really just has to do with treating emergency situations. So any sudden pain should be treated as an emergency, and the patient should be scanned by CT or some other means to visualize any trauma. Typically, people with VEDS have a really high pain tolerance, so if they are feeling sudden pain, there's probably something going on that needs to be investigated. Blood pressure patients should be monitored to ensure that they have low blood pressure and treated with medication if necessary. In this diagram, this is showing the arterial tree, and that should be scanned regularly by ultrasound, magnetic resonance angiogram, or CT angiogram. It appears most of the VEDS patients that I've interacted with, they seem like they do a yearly scan, just to kind of look for any aneurysms, anything that should be kept an eye on. Invasive procedures such as arteriography, colonoscopy should be avoided. They can lead to tearing and other problems. And elective surgeries should be avoided if possible. It seems like most surgeons say it's really difficult to work on VEDS patients because their tissue is like tissue paper. It's really hard to suture and things like that. So on to the most exciting part of my talk is Dr. Hal Dietz's research with VEDS knockout mice. He used a CRISPR-Cas9 system to make two different mouse models to mimic VEDS. In his 209, I'll just call it the 209 knockout, glycine is replaced by serine at codon 209. And then he had another knockout mouse that he generated at 938 where glycine is replaced by aspartic acid. And these numbers just signify where in the gene the changes were made to cause a change in the amino acid sequence of type 3 collagen. And as you can see, both mouse models compared to wild type just means it's the normal mice, they showed increase in mortality. And the more severe phenotype was the 938, and this kind of models how different VEDS mutations can cause different severities in phenotype. So the 938 knockout mouse had at 160 days 0% survival, and all of these mice were perishing due to aortic rupture. So the 938 definitely had a marked increase in mortality. And really the most exciting part of Dr. Hal Dietz's research was the RNA sequencing that was done. And what he found was when he did the sequencing that there were 170 differentially expressed transcripts. And the most significant part of this was he noticed in the PKC signaling pathway, there was a marked increase in signaling compared to wild type. So if you see here, there's increase in expression. And what this means is the signaling pathway is active. And this was just such a novel thing to find, that the signaling pathway was active. So Dr. Dietz was able to rescue the VEDS phenotype with a couple of medications that inhibit the PKC pathway, which is super exciting news for the VEDS community, and it prompted a clinical trial. So he subjected the 938 knockout mice to roboxastarin, and it inhibits the PKC pathway. And as you can see in this diagram, the 938 knockout mouse that was not subjected to the medication had 52% survival. The knockout mouse that was subjected to the medication had 94% survival. So really such a great increase in survival due to the medication. And this really showed that the spontaneous ruptures are due to the signaling pathway that's involved, and that is triggering these spontaneous ruptures. So him being able to rescue the phenotype with this medication is really huge. A2 Biopharma announced that they're going to proceed with a similar drug, enzastaurin. It's just another PKC pathway inhibitor as a treatment for VEDS, and that's starting very soon. Enzastaurin is already FDA approved to treat glioblastomas and other cancers. From some of the presentations I've been able to attend, it appears that this drug is very well tolerated. There's very few side effects. So I think A2's strategy is to go with a drug that is already known to be well tolerated in patients, and hopefully will have as much success as roboxastarin did with the knockout mice, it also being a PKC inhibitor. So this diagram is from a breast cancer paper, and it's showing the PKC signaling pathway. And in this diagram, it's showing vascular endothelial growth factor initiating, it's binding to a receptor and causing the signaling pathway to be triggered. And it's triggering mitogenic signaling in breast cancer. And it's showing both of the drugs that I've talked about, enzastaurin and roboxastarin, are both PKC inhibitors in this pathway. What's unknown in VEDS is why the signaling pathway is triggered, and it really needs to be elucidated the mechanism of what's going on and why is it causing the spontaneous ruptures. So that's something that still needs to be investigated. Just my works cited. All right, thank you.